And understandably, there is plenty of anxiety and confusion over exactly who can get tested for coronavirus.
Many who are sick are wondering if they have COVID-19, but they don't meet the criteria to get tested as the test kits are in limited supply. News 8's Alicia Summers got her hands on some, and she joins us now from Kind Health Group in Encinitas with a look. Alicia?
We are at Dr. Georgine Nano's office in Encinitas. She has a very limited supply of coronavirus tests, like most doctors do in San Diego County, if they have any tests at all. She's showing us how they work.
So this is a viral nasopharyngeal swab, which means it can go in the nose or the mouth or both. And there's two, you can see there's two, they look like long Q-tips. You can swab the inside of the nasal passages pretty high up in the nose, and in the back of the throat. It's either nose or mouth or both. And then you can put them in this transport media, this tube. You can see it's got a little fluid down there to just preserve the sample. We deliver them to LabCorp, which in our case is right here in our building, and then they send it out for processing, and then we get the result back in 3 to 4 days.
Family practitioner Dr. Georgine Nanos only has a handful of coronavirus test kits and hasn't had to use one yet. The guidelines are strict for who gets tested.
Technically, we need a lot, but again, they're in short supply.
Many people are being turned away from getting tested for COVID-19. For example, if they haven't been exposed to someone who has already tested positive, or if you have not traveled to one of the 5 heavily impacted countries outside of the U.S. in the past 14 days.
If you've recently traveled from Europe or any of the other 4 countries affected, like South Korea, China, Japan, and Iran, then you should be contacting your primary care provider to see if they can get you tested.
The county has announced that we all need to try to not overwhelm our healthcare system if we can manage at home.
This is going to be a very big problem for us down the road if we are misusing our resources. We have very limited resources for critically ill patients, and we want to save those for people who may need that.
Most insurance plans will cover the cost of a coronavirus test, but doctors say if you are sick, do not go to the ER, do not go to the hospital. Instead, self-isolate at home and contact your primary care provider. Back to you.
All right, good advice, Alicia. Thanks.